Good morning, everyone. Thank you very much. It's a pleasure being here today. So the reason I chose shockwave therapy as a kind of title of this talk was very much because I see this, I mean, in line with the theme of the conference, I see this as a very successful example where science, basic science, technology, medicine in practice meet to deliver the best care in the best interest of patients. So I thought this is a very good example of how from science we ended up in the technology that gave us very applicable clinical benefits. The topics I will be covering over the next 40-45 minutes. So I'll just give you a brief overview of what my day job is like. I don't know how many of you are of medical background potentially here. It's just to give you an idea of where I stand in this and how I'm using shockwave in my practice. That would potentially put things in kind of better perspective. Then I will go through some basics of shockwave therapy. I will touch on the mechanisms involved, the technology behind it, and the kind of biology and physiology and the way that it is proposed to work. Then I will have another few minutes on how we use it in sports medicine. What are the different applications that we have? What are the different implications, protocols, things we need to be aware of? And at the end, what I think would be kind of the future direction for this particular technology. So the first bit, to give you an idea of essentially what I do. I'm obviously a consultant specialist in sports and exercise medicine. So that's kind of seeing patients in clinics, anything to do with joints, bones, muscles, tendons, conditions, injuries, and diseases. So I use different kind of equipment there, including ultrasound scan, shockwave, and other things. I am also, as just mentioned, Vice Secretary General of European College of Sport and Exercise Physicians. There we kind of are very much involved with promoting the science, the practice. I do quite a bit of international speaking on different aspects of sport and exercise medicine. I'm involved with the University of Suffolk in the UK as well. But then there's a more interesting kind of hands-on field of play aspect of my job as well. So that's me in the London Olympics. I was a medical team leader